MMT, hip adduction, adductor magnus, brevis and longus, pectineus and gracilis. Assist the patient to the side-lying position with the test leg resting on the table. Position the non-test leg in 25 degrees of abduction. Have the patient slide as far back to the edge of the table as safely possible. Stand behind the patient at the level of the pelvis. Support the uppermost leg, which is the non-test leg, by cradling the leg with the forearm, using your hand to support the medial knee. Passively move the patient's hip through adduction. You're not assessing the infield, you are determining how much range the patient is able to move in this direction so that you can appropriately assign a muscle grade. In patient-appropriate language, ask the patient to adduct the hip until the lower limb contacts the upper one as you observe for any substitutions. Stabilize the patient by maintaining the pelvis in neutral alignment with your hand. Please note that it is not necessary to have the patient perform the active motion twice if no substitutions are observed on the first attempt. You may apply the resistance at that point. Common substitutions include the following: internal rotation of the hip to recruit the hip flexors. This substitution is accompanied by an attempt to turn from sideline to supine. External rotation of the hip to recruit the hamstrings with an anterior pelvic tilt. Thus, substitution is accompanied by an attempt to move toward prone. After correcting any substitutions, ask the patient to perform the motion as previously. Stabilize the patient by maintaining the pelvis in neutral with your hand or by using your hip. Place the hand of your other arm across the medial thigh, just proximal to the knee, to use a short lever. The force at the medial knee should be directed downward toward the floor. Grade 5, normal. The hip adducted to the available range of motion and the patient was able to hold the end position against maximal resistance with no break in the position. Grade 4, good. Hip adducted to the available range of motion and the patient was able to hold against strong to moderate resistance. Grade 3, fair. The patient is able to move through all the available range of motion in hip adduction, but is unable to tolerate any resistance. If none of these conditions are met, we must reposition the patient into a gravity-eliminated position. Assist the patient into the supine position. The non-test leg is positioned in some abduction to prevent interference with the motion of the limb. The gravity-eliminated position of the therapist is to stand on the side of the limb being tested at the knee level. One hand supports and lifts the leg by holding it under the ankle to raise the leg just enough to decrease friction. The hand offers no resistance, nor should it assist the movement. The other hand palpates the adductor mass on the inner aspect of the proximal thigh. Monitor the femur for any substitution motions. Ask the patient to attempt to adduct the hip while keeping the hip in 0 degrees of rotation. Grade 2, poor. The patient completes full range of motion in the supine position. Grade 1, trace. There is partial range of motion, or you are able to palpate a contraction of the adductor mass on the proximal medial thigh. Grade 0, no palpable contraction.